Hi everyone, I am Dr. Prudwiraj, Consultant Endocrinologist at Arete Hospital, Gachibowli, Hyderabad. Today I am going to talk about obesity. Obesity by definition is presence of excess fat tissue in your body. Its prevalence is increasing gradually in India and it is increasing in a very dangerous level. According to the recent study on 2015 numbers, around 11 to 30% of the adult Indian population are overweight and obese. How this obesity is categorized? It is categorized based on the body mass index, that is weight in kgs by height in meters square. If your body mass index is in between 18 to 22.9, then you are having a normal weight for your height and maybe you are healthy. And if your body mass index is 23 to 25, you are overweight. And if your body mass index is 25 to 30, you are having grade 1 obesity. And if your body mass index is 30 to 35, grade 2 obesity. And if your body mass index is 35 to 40, you are having a severe obesity. And if it is more than 40, you are suffering with morbid obesity. So why obesity is very much important? As obesity can cause multiple metabolic conditions in a patient at a very young age, it needs to be tackled, it needs to be managed in the initial stages itself. As it is a reversible condition, it is better to avoid the metabolic complications that can develop because of obesity. What metabolic conditions it can cause? One thing obesity can lead to is it can cause hypertension at a very young age, type 2 diabetes at a very young age, and you are prone to develop heart diseases, brain strokes at a very young age. You are prone to develop fatty liver disease. You're prone to develop osteoarthritis, obstructive sleep apnea, or snoring. You're prone to develop polycystic ovarian disease or metabolic syndrome, or you're prone to develop GERD, gastroesophageal reflux disease, or peptic ulcer disease. You're prone to develop certain cancers also, especially breast cancer and colon cancer. So to avoid all these metabolic conditions and malignancy risk, it is better to keep your weight under check and keep your BMI in a normal range, that is 18 to 22.9. So how to manage this obesity? So for any obese patient, first of all, we need to correct their diet and exercise schedule. We need to correct calorie deficient balanced diet to cover their important macro and macronutrients and to keep a negative deficient of 400 to 500 calories in a day, and they need to lose their weight in a healthy, sustainable way. They need to lose their body fat percentage, not the muscle mass. So to lose the body fat, they need to consume adequate amount of protein and they need to mingle both cardiac exercises and strength training exercises in the daily schedule. And coming to other form of management of obesity, that is medical management of obesity, there are multiple drugs available right now in the market for the obesity, and there are many drugs that are coming to launch in India very soon for the obesity. So as you already heard that Elon Musk has used this Ozempic Wegovy, that is a form of semaglutide, which helped him to lose more drastically weight, and it is also going to come into the India very soon. And we have other options of treatment in India rightly available today. If you want to go for a medical management of obesity, consult your endocrinologist nearby.